We have 4 main work streams that we've created towards the summit. Harvard is actually doing an economic study on the costs of NCD. And to that, we've added also mental health to resonate all of the issues that have been raised before. And with this is only to show what the costs of mental health are in addition to the costs of NCD. A second work stream is a consultation on the role of the private sector and its way of working with other stakeholders towards NCD. And a white paper is being developed at the moment to look at some of the partnership initiatives that the private sector has done with other stakeholders, many of you here around the table, and see how that can be moved forward after the summit. The next one is working with private sector in the role as employer, looking at workplace health and workplace wellness. We created the Workplace Wellness Alliance 1 year ago. And within 1 year, what the Alliance has done is develop and collect a set of homogeneous indicators for NCD across all of the employees, and at the same time looking at what are ways to improve existing workplace wellness programs that are being done across the globe. And it's amazing to see the amount of work that is being done out there by the private sector and how little we know about it and how little it's actually being evaluated. So the aim of this initiative is to try to first create this baseline on health of the employees. Hopefully that will move down to the health of the families and the communities, the children, and so on. At the same time, helping to calculate the return on investment. Again, this is in the role of employers. The last one is, one more, Ceci, is working with the private sector in the role as producers and providers of services, and very much looking at what incentives are necessary to change the way that the private sector operates, to change the salt content and to reduce the sugar. What do they need? What is the type of dialogue that we need also with governments to incentivize governments to start shifting and changing the own sort of different buckets in their houses? And what are the different incentives that are needed at the individual level for all of us to change our behavior? So a big piece of work being done there on partnership models, all of these feeding into the UN summit. Now on that one, next one, Ceci, please, is a partnership that we just developed with the Pan American Health Organization and cities globally. I know that some of you heard about this yesterday, to organize a Wellness Week during the time of the summit, both in New York and across other cities in the world, to highlight what are these multi-stakeholder actions that can be done to promote health, and what are the roles of the different stakeholders in that, including within this the private sector. Next, Ceci, please. So we have a long roadmap, and we've just came up from Davos, where we managed to put on the agenda for the first time actually in a long time 2 plenaries on health. One on NCD, where we had the Secretary General, and one actually on raising healthy children. And the idea, where Margaret Chan was at, the idea of this was actually trying to do what we've just discussed, which is to bridge the child and maternal health dialogue into thinking about children as a common life stage for addressing both NCDs and all the other issues. What we have as we move forward is we work closely with the NCD Alliance. We have a meeting coming up in Geneva next month. We work closely with PAHO, and we're working towards Rio on a salt reduction initiative and the Wellness Week. We're here for any other groups who want our help, or however we can work together. But for us, what's really important is not the UN summit, but what will come afterwards. So what we're starting to do is to think about what are implementation and how implementation opportunities and very clear actions that need to happen, and what are the partnerships that need to be consolidated as we move forward to September and beyond, so that we, as a platform where we used to announce important issues, we can come back to Davos next year and have very high-level visibility of the summit and what comes afterwards. So what is a successful UN summit? It elevates the issue to the prime minister level. It uses the economic considerations to highlight the burdens, but also to make sure that it allocates the resources accordingly. And it gives very much importance to prevention. And there is a concern, I suppose, that it's important we balance both the prevention and the treatment, and we engage the non-health sectors as well as the health sectors. But what you see in the red box is what actually worries us or is of our concern and current work now. We've talked about accountability. It's important that we start harnessing what are the core competencies and the expertise of all the different players. And I don't think we yet know what we all think about this. So a bit more discussion around this issue would be most welcome. And at the same time, and we've talked about that as well, is the indicators. We need to make sure that we know what we want to measure, and we have the measures available for when we come out of the summit in September. We already have a baseline and something actually to measure against. There will be a call on and support for the need of cross-sectoral collaboration. And what is cross-sectoral collaboration? Who are the partners? What partnerships do we want to see in place? And what are the roles of all these different sectors? Again, we feel that more discussion around that would give us more clarity on how we want to move forward. The last one is we expect that the summit will catalyze action. And we're talking about this again and again. But we wonder whether a very clear action plan with implementation steps is going to be available by then. And unless countries and member states and the other stakeholders are clear about what they can do very concretely, we might not achieve what we want. So my last slide is answering James's question of what do we need to make this possible? What could WHO offer? I think a clear implementation plan that goes hand in hand with the action plan of headquarters that has concrete actions that we have in time for the summit and is referred to as the manual for implementation and way forward. Many countries know what they have to do, but not concretely how to go about it and who are the partners they need to do this with. So this might be helpful. The second one is a platform and a mechanism to engaging the stakeholders. And this needs to be global. It needs to be in place by the time we get to the summit. And it should maybe already highlight some of the successes that such partnerships can do together. So again, having some of those big questions answered around, and particularly then your thoughts from the forum side, what we could bring to the table is what are the areas that the private sector can contribute to the fight against NCDs, what are the core competencies we want to leverage on as we move forward. And this is not only thinking to the summit itself, but going forward as we start implementation from September onwards. Thank you.